So I am Arnethia Sutton. I am going to be Rudine for today as she is absent. And we thank you for joining us for another session of Facts and Faith Fridays. Today we're going to have some updates, which I think are going to be very interesting. We're going to have some updates regarding national updates regarding COVID-19 and information from the CDC. We're also going to have some updates as they pertain to the city of Richmond. And so we ask you all to be engaged in the discussion, use your chat, and hopefully we can facilitate some great discussions around both of those topics. Before we get started, I would like to ask one of our Facts and Faith founders, Reverend F. Todd Gray, if he will open us up in prayer.
Let us pray. Lord, we thank you for every opportunity that you afford us that we might gather like this. And we thank you for the ways that you have used this forum to bless not only the faith community, but the collaboration with the medical community for the lives that have been touched, and for all those that have loaned up their gifts and their talents in us trying to edify our congregations. We thank you for what you continue to do. We pray for all of our presenters today that you would bless them according to their need, and that you would bless us according to their talent. In Jesus' name, amen.
Amen. Thank you so much, Reverend Gray. So I'm going to turn it over now to Dr. Wynn, who's going to provide us with our monthly updates, COVID, flu, and everything else that he feels open to share with us. Dr. Wynn.
So it's good to see you guys all again. Let me just make this real simple. Things are getting better mostly. The 4-week trend of number of COVID cases has continued to trend down. I think that the number of flu cases and all the rest of these other things are also starting to trend. It's been an interesting time because in addition to the flu, in addition to COVID and RSV, it seems that almost even just a common cold, when people get it, can actually really hit you hard. We have an expert that's going to be with us. And actually not only an expert, but we'd call her a family member, Dr. Christa-Marie Singleton, who is outstanding and is here representing the CDC. So I will let her talk a little bit more about what we should be thinking about, what other things are going on throughout the country. But as it relates to Central, Eastern, and Southern Virginia, at the moment, the number and trends of cases due to COVID specifically over the last 4 weeks is trending down. What does that mean? I think we're going to continue to have the discussion about how do we stay safe? When should we wear masks? And I'm kind of getting it that if you have a cough, this is one of the rules of thumb, this is my grandmother would probably say, if you have a cough and if you're coughing around, you might want to just consider putting on a mask, just as a point of reference. So having said that, I'm going to give the floor over to Ray, who is actually going to do this really cool thing. We actually had, with Ray Cousins, I had this discussion about the impact of economics in communities and how that impacted social justice. And I was like, you know what? Hadn't really thought about that in exactly that way. And said, you know what? It's clear that she has some good thoughts around this issue. So we were going to allow Ray just a few minutes just to bring these topics up and then have a couple questions for her.
Sounds great. Thank you, Dr. Wynn, and thank you, everyone, for allowing me to be here with you today. As Dr. Wynn mentioned, my name is Ray Cousins. I'm a 4th-generation Richmonder, an attorney, and I am also running for the Virginia House of Delegates in the new 79th district here in the city of Richmond. So there have been a lot of conversations about economic justice, and I've been thinking about this a lot, particularly in minority and low-income communities, creating economic opportunities so that everyone thrives and is successful. And to do that, there are obvious issues that we need to address, like fully funding schools, ensuring that everyone has a sustainable living wage. And also, I think education about and access to entrepreneurship opportunities is also important. But we need people to be healthy. And I think that starts with ensuring a clean environment for everyone. So we're all aware of the history of redlining and discriminatory lending practices in the 1930s that resulted in these areas of concentrated and generational poverty, including right here in the city of Richmond. And studies show that communities that were affected by redlining, there's data now, are more likely to experience shorter lifespans and higher rates of chronic diseases like asthma, diabetes, hypertension, obesity, kidney disease, a gamut of issues. And I believe that these health issues are directly tied to disinvestment in and environmental decisions that have affected our communities throughout the years. So for example, here in Richmond, public housing communities are very close to interstates. And our kids and families have been breathing in car exhaust and other emissions from cars and trucks traveling these interstates 24 hours a day, every day for a number of years. The New York Times recently published an article, it was actually last year, that illustrated heat maps here in the city of Richmond. And those maps show that the largest heat indexes are in low-income communities here in the city. And so the lack of trees and green space is the commonality in all of these neighborhoods, which can lead to respiratory, mental, and heat illnesses and obesity. Also, too many of our low-income families live in housing that's in disrepair and contaminated with environmental irritants like mold and lead. And these affect people's health. And too many families are also living in neighborhoods that include very little access to fresh, affordable, healthy foods. So I would like to see more investment in studying how the environment where our families live affects their health. I would like to see studies on the environmental irritants that exist in low-income housing so that we have data and can fully address those issues. Virginia passed a food access investment fund in 2018. And so I'd like to see us expand that fund to leverage partnerships with community farmers and gardens to ensure that every community has access to fresh, affordable, healthy foods, and also provide incentives or rebates for grocery stores to operate and provide, and I think the important word here is affordable, healthy foods in our communities. And lastly, I would like to explore amendments to our zoning laws to require developers and builders to not only protect healthy trees that already exist, but also to make a commitment to grow additional trees in developments in areas that are affected by the lack of green space. There are so many issues that we need to address to ensure economic opportunity for everyone. And I think the relationship between the environment and health has to be a top priority. And so I would encourage you all to lobby your local, state, and federal representatives to address these issues. And I thank you tremendously for the work that you're already doing to educate and advocate for the health of our communities.
Great, that was fantastic. We
Thank
definitely
you.
have time for a couple questions. Do we have any in chat? I have one question if you're okay with it.
Yep.
So as we start thinking about this issue around environment and health, as you think about what are the things that could be done in the area of Richmond, are there low-hanging fruit type efforts that could get things started?
Yes, I mean, I think with our food deserts, we talked about this we've been having this conversation for years, and we've seen an increase in community gardens that already exist in the city. So I think that's low-hanging fruit right there, is partnering with community gardens and farmers and including them in conversations about educating our kids and our families on fresh, affordable, healthy eating, but also giving them the tools that they need to grow their own food. I mean, I think we can use urban community farming as a way to create pathways to success and entrepreneurship as well.
I think there's a question that says, any plans for engaging the faith community?
Yes, I think there is in terms of education and also lobbying and advocating our elected officials, I think there's a definite space for the faith community to be involved in those efforts.
Well, this is fantastic. I think we have Dr. Tosis.
Couple of things. One, can you reiterate again what seat you are running for? And
yes.
Then just want to hear more about, your thoughts around, I guess, sort of running during this very divisive time and your thoughts around, engaging and bringing together different voices.
So I am running for the Virginia House of Delegates. I am running as a Democrat. It's the new 79th district. It's a completely open seat. It's a newly redrawn district. It's located all in the city of Richmond. So it includes some parts of Northside, Churchill, Jackson Ward, and then it goes across the river and picks up Manchester over to Forest Hill Park. So all within the city. We are in a very divisive and vitriolic political climate. As an attorney, I have to obviously approach issues from a very logical and practical standpoint. And also I've had to learn how to negotiate. And I think that will be very important in bringing together, all voices, and also having participation, bipartisan participation across the aisle, because that's so important to, get things done. Obviously, I would like to see the Democrats get our majority back this year, but we still will need partners on the other side of the aisle to accomplish initiatives and objectives.
Yeah, we around in a cancer world at Massey, we call this the one team, one fight. You can't beat cancer if it's not one team, one fight to focus. Mm-hmm. We have one last question, and I know that there are some other questions, but we hopefully will see you back, no matter about again how we can help with this issue. Yep. There is a quick question that says, how would you see school curriculums incorporating health and wellness? And I'm going to add the impact of the environment and health and wellness into school curriculum.
I would love to see, ideally, a community garden at every single school, if we could, implement that and fund that. Just because, I think it's just so important to show our kids and families just how accessible healthy food can be. In terms of curriculum, I know that there are some great programs that are happening right now. For example, at John Marshall High School, I believe they have like a culinary program where kids are being exposed to fresh foods and how to prepare them so that they are able to cook their own foods at home. And so I would just like to see more of that across the city and incorporate it into all Richmond public schools.
Fantastic. There is one other experiment that's actually happening in New Jersey that I'm actually will hopefully happen here as well, and that is getting all of our high school people to understand how to actually consume information. And really, as they are talking about electronic information from your TikToks and from how to actually validate sources and all the rest of these other things, and I was laughing, New Jersey's the first state in the entire country that mandates actually having a curriculum around young people understanding how to get their information, how to validate the information, how to source the information. And hopefully in the future, we'll have you back, because I want to talk a little bit more about how we in Virginia can also do that. So I want to thank you very much. I think there's one quick question.
Yep. Yeah, Dr. Wynn, I think, Al, do you have a question?
Yes, thank you. My question was, I'm also clergy and health educator for LifeNet Health, and we are looking at how the food desert concept is actually going to help improve the overall health of people of color in the Richmond and the greater Virginia area around healthy eating takes the stresses off of our body organs. Mm-hmm. And so by being the organ procurement organization for majority of the state of Virginia, we, LifeNet Health, want to get involved in how and promoting the food deserts. Healthy eating is something that's going to help people of color, where we have a concentration of a One Hero campaign going right now. We want to help educate and sow into any efforts that you're directly educating the public on the importance of creating food deserts, food gardens and community gardens in communities. So you can count on LifeNet Health support in our efforts and all of our resources. So just keep us posted about anything where you're educating community about healthy eating, and we want to be a part of that.
Oh,
You know
well,
what?
thank you so much.
I want to pick up on that real quick and say that it's to my surprise that even we think about Richmond and urban areas, but I didn't know areas like even around Danville and some other areas like that, Petersburg and Danville, and some rural areas also have issues with food deserts. I mean, it blew my mind to sort of say, well, how can an area that's supposedly rural actually have issues? But they do. So thank you for bringing up that really amazing point, that the issue of access to food for everybody will actually, not only is the smart move, it will likely keep us healthy. So
yeah, definitely. And just to point out, I'm glad that you made that point, because in bringing different voices together, I think rural communities and urban communities have a lot of the same issues in common. And so if we can find a commonality, just in the way that we talk about the issues that affect us without bringing in, social issues, I think we could definitely make some headway for all of our low-income communities, for sure.
Listen, you rock, and keeping fingers crossed, and we'll keep everything posted, and you'll keep us in the loop, and we'll continue to follow along, and best of luck. And thank you for what you do and what you're trying to do. With that, I'm going to turn this back over to Dr. Sutton.
Thank you so much, Ms. Cousins, for joining us. And I echo what Dr. Nguyen said, that I hope that you will join us again. As you can see from the chat, our group is very interested in the topics that you brought up, and we have been for a while. So thank you very much. Our first fireside chat speaker today is none other than Dr. Christa-Marie Singleton, and she is certainly no stranger to Facts and Faith Fridays, as she was a godsend as we work together to navigate the COVID-19 pandemic. For those of you who may be unfamiliar, Dr. Singleton is a pediatrician by training, who currently serves as the Chief Medical Officer for the Office of the Associate Director for Policy and Strategy at the CDC. Dr. Singleton, thank you so much for taking the time to join us again for what I'm sure is going to be a very informative dialogue.
Hold on, Dr. Sutton, you ain't saying the most important thing.
What's the most important thing, Dr. Nguyen?
That she's from and graduated from the great University of Notre Dame.
My goodness.
How we forgot that?
Okay, I'll let you two have that. That's important to you too.
No, it's a pleasure to be here. And while Ms. Cousin is still here, I just want to say thank you for what you're doing. And I'm not sure what Dr. Nguyen's going to throw at me, but I would also offer in this conversation to tie this to not only as a healthy community, but a productive community, and look at the financial implications of what you're doing. We are working on a project within my little group. So actually, I have moved offices of sorts within CDC in our latest reorganization. So now there is now a proposed Office of Health Equity. So I'm the Chief Medical Officer in that group, still to be determined. But one of the things that has been a passion project of mine, and I finally got some support to help do it, is looking at, as Dr. Nguyen talks about the zip.
Yeah, I was checking, were you gonna?
We lost somebody there. So the zip code of our own employees and looking at where they go. And so what we're overlaying is a group of CDC employees and their zip codes and their proximity to food, period, is what we're looking at. Because one would assume that federal government employees all got a job, all got money. And what we are no surprise finding is that they are in these spaces and what we're looking at. And so the economic impact of it's not just healthy. An individual who doesn't have access to food to carry through their medication plan or their pieces of it can't go to work. And if they can't go to work, that means they ain't got no money. If they ain't got no money, they can't have a house. And so it all feeds into it. And so where I live in Georgia, health and the economy have been inextricably linked. And our governor ran on that. So what I would encourage you all to do and consider, Ms. Cousins, and you're clapping you up in what you do, is tie in the financial components of this. Because as a colleague of mine said, it's changing hearts, changing minds, changing mandates, but also changing market share. So if you can show how this affects the economy in the various counties in Richmond, we'll go there, because I have a part of my talk, I'm going to talk about some of the economic impacts that COVID has done. So there you go.
Thank you.
The very first question that I had is that I'm not quite certain where we are with COVID. Are we through COVID? Is it over? Will we have to now continue to get a fourth, a fifth, a sixth shot? What's the national COVID outlook?
Well, I would say that COVID is here probably to stay. It has taken up residence. It's like, the guest that is around. And in fact, recently CDC has put the COVID vaccine as part of its routine series of immunizations. So just as your kids get their series, and we recommend that you get an annual flu shot, this now is part of that recommendation, because vaccination is a key component of protecting us against. It's a key piece of that arsenal, that raincoat, as I talked about, that multiple layers to do that. And we are at a point now where we have an updated vaccine that it protects against the virus. As we talked about before, it likes to change its coat and shape and duck and dive and try to get around. And so the most current vaccines are protecting us against each little layer of the variants that are doing it. So what we have been able to see over this last year or so is that this current formulation is still standing strong against every time this virus tries to try a new flake, it's still protecting people. And in fact, I'm trying to see if I had my little slide here. I can share this one. So right on here, an updated COVID-19 vaccine still shows it's still safe, it's protecting people. And against people who have not gotten it at all, the biggest thing is you don't want to die. You might still get sick. And I've had COVID, my son has had COVID, and we had very mild courses. The kid who is an asthmatic had runny nose and cough and sneeze, loss of smell for about 3-4 days. And then he's been fine. Mama had a sore throat for about 3 days, and then I was fine. Husband seems to have ducked it all together, and my 87-year-old mother has ducked it all together. But the point is, you don't want to die from this. And no matter, over these last 3 years, we consistently keep showing that vaccination saves lives, even in the children's pediatric population. And so we are recommending that people still get their COVID boosters. And what we are seeing is that people have gotten vaccine fatigue out, and that if you got your vaccines, when we first were gung-ho about it, and then you said, I'll chill, those are the people that are more likely to get sicker. So if you have not had your COVID vaccine booster prior to, if it was before October of last year, you really need to go get one, especially we're still in cold and flu season. So it would be in your best interest to make sure you've had that vaccine, the most current variant version.
So I'm going to follow up on that, and then I'm going to turn the next question over to Arnithia. But the question that ensues that, what's the current findings or the current thought about getting children and our babies sort of vaccinated and its effectiveness? Because as you're sort of saying this, I'm starting to think it's going to be around, which means adults are going to have to make sure you get your first and your second and your boosters. But it probably seems that will the vaccine also become probably fairly routine for the kids? And how is that vaccine doing for our kids? Is it doing its job? Is it protecting them?
Yes, and that is I just pulled up the most current, what we call our morbidity and mortality weekly report. And so this is a study of looking at that particular vaccine in that, remember, the little ones were the last group to go. And the reason why they were the last to go is because not only can't you just give a smaller dose, but then you really need to see, is that smaller dose going to have the same level of effectiveness as it does with us old folk? And what we're seeing, both the Moderna and the Pfizer for kids ages 3 to 5 and 3 to 4, it is protecting them against symptomatic infection for at least the first 4 months. So it's worth it, because as our previous speaker was saying, you're talking about the economic impact. You got a sick kid. That means sick mama, sick daddy, sick grandma. Somebody got to stay out of work to take care of that kid. In addition to so I go hearts, minds, market share mandates. So you got to protect that kid. That's the most important. But if you're not caring about the kid, make sure somebody's got to stay around. So the vaccine is protecting the children, and it is making sure that they get both of their doses. And so that's what we're seeing is showing it's very, very safe with them. It's showing that it's caring, it's protection, similar to the adults. And so it is worth it to get it. And I know a lot of parents were waiting, and you in your communities and in your churches might say, I don't know, no, I want to wait. I want to go wait and go see. Well, you got almost a year's worth of data now with kids. And that means we're good to go. So I vaccinated my kid. If he were younger, I'd still get him vaccinated. So do it.
Dr. Sutton, next question.
Dr. Wynn, let me get in here real quick.
Oh, yes, sir.
Dr. Singleton, we talked about this prior to opening up to public discussion, but what is the CDC's recommendation for church gatherings and masking?
Well, a couple things is that if you are immunosuppressed, then meaning that you've got, cancer or some other kind of issue, then it might be in your best interest if you're going to be in a crowded setting to wear a mask. But we are not required. We, the federal government, of course, can't require anything, and we're not recommending it for the routine public unless you feel like you're going to be in a crowded situation or around people where either you don't want to get sick or you don't want to spread what you have to each other. And so we recommend in terms of masking that if you're in a crowded space, you might want to consider keeping that mask, but it is not a requirement. So that's where for these larger settings, what we were saying. A second piece that we would recommend for churches and others to think about is to have a testing plan. In that right now we've got a lot, right, at least until the public health emergency ends, which is going to be in a couple of months, these test kits that were given out are still free. So stock up on your free tests. But the point is, if you start to have some symptoms, sore throat, cough, whatever, there's enough testing out there, get tested. And the reason why we're recommending getting tested against COVID is because there are now treatments for COVID, particularly for a lot of people in our 50 plus age group or people with other conditions. And these treatments are very effective, which again, keeps you out of the hospital and keeps you from dying. So basically, if you don't know, now you know. The sooner you know that this is COVID and you can get access to some of these treatments at home and keep you out of the hospital, that's the way to go. So that's where I would offer the church community, you guys can help us remind people, if you want to wear a mask, fine, it's not a requirement. But if you get sick, there's still testing and treatment out there, and make sure you can at least talk to your providers about getting them.
So Dr. Singleton, it sounds almost like the airlines, that when you get on, if you want to wear a mask, you certainly are encouraged to wear a mask. But the basic tenets are, if you have a cough or you have a cough, you don't know it's COVID yet, or you don't, whatever, you really should probably be masking up. Is that correct?
Right. Yeah. And so this is kind of like what the prevention piece of it, always stay up to date on your vaccines. And so now up to date of the vaccines means you've had that primary series of the 2 shots of either Pfizer or Moderna and your booster. And that booster needs to have been, if you haven't gotten your booster after September or October of last year, please go get it. What we are noticing is that people jumped in and went all in on the primary series, and the booster numbers are really, really low. And so get that piece of it. When you can, particularly if you're sick or an immune system or live with someone who does, as much as you can be outside as possible, that helps. The ventilation always helps. And again, think about your testing and treatment locations before you get exposed or sick. So around me in Atlanta, I got a box of probably 10 free COVID kits down here underneath my desk here. But I also know that around the corner, 3 or 4 miles away, I know where the testing options are, so that if I needed to I want to make sure that it's the real deal, I know. So that's part of your action plan. Vaccination, know where the testing locations are, know where the treatment options are, because now the treatment options are now over the counter. Your doctors can prescribe them. So those are options as well. And then always, like we said, like Mama's taught us, wash your hands. And then if you're going to be in a crowded space where you're tight with folk, like if you're going to be traveling on the plane, that might be a space to wear a mask. But that's not requirement on the daily.
All right, Dr. Singleton, we have time for 1 or 2 more questions, and we actually have 2 in the chat. So one, some have suggested we are going to an annual COVID shot like we do with flu. Flu has a season so that we only need 1 shot a year. What is likely to happen with COVID? Will it become quote unquote seasonal?
Yeah, that's where the research is going toward, a single shot. And the flu season of sort really does, remember, it goes kind of from September through March, April, depending on the location of the country. And so there are several scientists and several companies that are working to see if that window and try to really advocate for people to get maybe that combination within that window. But remember, there's plenty of boosters out there and folk aren't getting them anyway. So, but we say get that 3rd booster. And if we go to an annual shot, that's kind of like where the goal is going. And I did see another question in the chat, if you got a couple more seconds. Are the numbers of those experiencing those long haulers decreasing? And that information is still to be determined, but what we are noticing, again, a little bit more in Black and Brown communities, is that because our Black and Brown folk weren't the first ones to jump on the vaccination, their symptoms of COVID and their experience with COVID was more serious. And they are the ones that are tending to show these lingering symptoms, i.e. the long COVID. So that's another reason why, if we're talking about social justice, racial justice, health equity, the more we in Black and Brown communities in particular can get vaccinated so that if we are having to have COVID, it will be less severe. It drops your chances of being in that long hauler group.
Can I ask one question, pick up on that? I started looking at some of the numbers as well. And so certainly our underrepresented groups, our at-risk groups we're getting that. But there's this new trend of folks within rural community who are completely uncovered, in some cases with lower rates of vaccine uptake. What is the strategy of the CDC, because I would imagine that long COVID is in many of those communities that probably may not even being picked up. Is there a plan from the CDC or a national plan to ensure that there is better either education or better awareness within some of the rural communities in the United States as well? Because yes, I see that as a problem as well.
Yes, because I was just we were looking at the vaccine rates and where the lack of uptake, it is actually now more in these rural communities, actually more in some of the white evangelical communities, because they're like not getting vaccinated. So therefore their outputs and their cases are going to be worse. And so the same kind of advice that you, Dr. Wynn, created with this community about having trusted agents, that's what the national plan, but what we are encouraging is to find trusted agents in these rural communities and in these places to show why this matters to them. Talk about the quality of life, talk about what you are doing, what's the cost of you not getting vaccinated. Because I think Ms. Cousins was talking about economic justice. This new study that came out looked at the economic costs with post-COVID syndromes or post-COVID. It was showing that those who were unvaccinated, the physicians had to get paid more. The cost of their care was higher. The out-of-pocket costs for somebody who's not vaccinated are higher when you get sick and end up in the hospital. That's not talking about your loss of time from your job. That's talking about how much money your hospital bill is going to be higher if you're not vaccinated. So I tend to look at the money pieces of it. And so that's another reason why, is to really kind of talk to people about get vaccinated and get your action plan so that you don't have to pay out of pocket.
You are awesome, by the way, and thank you so much. And you know what? This is not a threat. It's mostly an invitation because your family. We're going to want you back probably next month.
Absolutely.
We're going to work on it.
Awesome.
Thank you so much, Dr. Singleton.
You're quite welcome.
So next, like Dr. Singleton, our next guest needs no introduction. Some things you may not know. So he currently serves as an advisory board member of the U.S. Conference of Mayors, where he serves as chairman of the Children, Health, and Human Services Committee. And he also serves as president of the Democratic Mayors Association. He has visited us before, and we are tremendously grateful that he decided to join us again for an all-encompassing discussion about the city of Richmond. So Dr. Nguyen and Reverend Gray, I'll turn it over to you all. Welcome, Mayor Stoney.
Thank you, Dr. Sutton. Dr. Gray, Dr. Nguyen, it's always great to be in your presence once again. And so, let's get to chatting. Let's get to chatting here on a Friday evening. But first, can I just say this though? It was Dr. Gray who invited me on a call right in March of 2020 when the pandemic struck. And Dr. Gray, you remember there was a lot of anxiety on that call because there was a number of pastors and faith leaders who were worried about their houses of worship, worried about their congregations. And if it wasn't for people like Dr. Nguyen, our friends at VCU, the friends at the Richmond Health Department, I think my administration as well, who knows whether or not we could have navigated through such a difficult time. But as I look here in 2023 and I listened to Dr. Singleton's remarks earlier, I dare say that we have made it to the other side by the grace of God as well, but also by the use of science too. Dr. Nguyen, and you have been preaching how science, medical science, could be a game changer for people during this difficult time, this pandemic, and many have listened. And so you guys have been game changers, I think. You've helped save our community, and I'll always be grateful to you.
Mayor Stoney, thank you. I'm going to turn the floor over to Dr. Gray, though.
Well, and I do want to remind you that our hair was a lot longer back then because we were all afraid of haircuts. So,
I remember you talking about, I got some clippers now.
Yeah,
like,
you had a fro back then, but anyway, I do want to thank you for being an initial partner in this from the very beginning. And not only did we deal with trying to best inform our congregants of how to respond to the pandemic, we were also dealing with protests. And one of the things that I would ask you to address, because we had so many protests after George Floyd's death, and now we're dealing with Tyre Nichols and the response to that. And then I just saw on the news today something else that had happened in Louisiana. How do you think the city is prepared to deal with, our people when we do have issues like that? And I know you've been through 3 police chiefs since we started talking. So I just wanted you to address that.
Well, first, let me just comment on the murder of Tyre Nichols first. And, I struggled to watch that video, Dr. Gray, because what I saw was horrific. It was unacceptable. It was heinous. And what I saw in that video wasn't policing. That was violence just for the sake of violence. Violence for the sake of violence. And as I know that a number of departments across this country are struggling with adding officers back to their ranks, we cannot cut corners right now and just let any old person into the Richmond Police Department. And so as we continue to recruit and add to our ranks, we got to keep the standards at its highest if you want to be a Richmond police officer. And second to that, we have to continue to train and retrain our officers. We've added additional de-escalation trainings to our officers, cultural awareness training as well, so that new officers can learn about Richmond's history, how we got here, why there might be some sensitivities to police officers and those who might have been justice involved. Additionally, I'm grateful that we follow through on some of the work of our task force that we started in 2020, reimagining public safety. We've been able to agree with city council on a civilian review board because we believe we want the police department, we need law enforcement, but also we desire accountability as well. What I hear from folks in Richmond, in our Black neighborhoods, whether in North Side, or the East End, or South Side, they say, man, we want the police department. We need the police, but we want the police to show up the same way they show up in the West End, right? And treat us with the same dignity and respect they have for the residents who live in the West End of the city. And I don't think that's too much to ask. I don't think that's too much to ask. And additionally, I will be remiss if I didn't recognize the fact that the added complement, I would say, of technology has gone a long way. We would not have seen, if it wasn't for the body-worn cameras, and if it wasn't for the eye in the sky, the security cameras in the Memphis Police Department have all around the city, that we would not have seen how brutal and heinous that beating was by those officers. And so when you're down 150 or so officers, 148 officers, you need some added help. And that's where technology will come to play. We're going to add a real-time crime center here in Richmond, which is used in places like Las Vegas, Miami, New York, Birmingham, Alabama, which will essentially be an air traffic control for police officers on the ground. But also, it will be a tool for accountability as well.
Thank you for that. In your role now, Mr. Mayor, in the context of being the mayor of mayors, as you guys are actually thinking about where we are right now currently, particularly in economics, how are mayors thinking about how to grow the cities, how to make them more vital, how to bring businesses, and how does that relate not only in the national level, the discussions that you may be having, but how will that impact what we have right here in Richmond?
Well, you know, Dr. Nguyen, I know you got a little Chicago in you. So you've been a long time city dweller, and believe it or not, outside of the Great Migration from those who left the South to the North, and then you had white flight happen in the 70s and 80s. This is on the third greatest migration of individuals. And that migration pattern is those who are leaving the suburbs in rural areas, moving back into cities. And so we have become a magnet for more and more people. A lot of cities right now are having to navigate the housing crisis. We are all experiencing it. And it's not just cities as well. Counties, suburban counties are experiencing it as well. And I would say this right now in America, simply, not just in Richmond, in America, we need more housing, period. We need affordable housing, but we need an abundance of housing as well. We've added 1,900 more households, renters became cost burdened last year. That means they spend more than 30% of their yearly income on housing. And so I'm a big believer in removing the constraints that choke or create choke points for getting more housing units into the market. And also I'm a believer in density as well. Richmond is 60 square miles. We are landlocked. There's no annexation in Richmond. Unlike, in Charlotte, unlike in Louisville, this is not a combined city county government. So we have to go up. We have to go vertical. And so as we go vertical and we grow the city, we have to also do that with intentionality, with fairness and equity in mind as well. Because if millions, heck, billions of dollars are being spent to build new homes in Richmond, first, I believe that African Americans, women should partake in some of that growth as well in terms of financially. And also, I believe that we have to make room for those who are currently living in the city. Ms. Jackson, who's lived in Highland Park for her entire life, should be able to live in Highland Park for the remainder of her life. And so we are putting emphasis on, obviously right now, giving tax rebates to our household, to our homeowners, but also we got to work with the state to try and lock homeowners into the tax price that they're in right now. So as things start to escalate, which they have already, Miss Jackson doesn't lose her home.
Which is a big issue, and I'm glad you addressed the affordable housing issue, but the issue of gentrification, particularly in my neighborhood. But I know we don't have time to delve deep into that conversation. One of the things that I wanted to ask is, what did we learn from the pandemic in response to the pandemic, and how did that improve the way in which we would deal with similar situations in the future?
Well, cities have not been developed or prepared to, I think, handle like 100-year global health crisis like a pandemic. But what I think something that we learned is we have to build this sort of resiliency into our operations. I think in the past, we've been prepared to handle natural disasters, hurricanes, flooding, earthquakes, things of that nature. But we've never been prepared for a public health crisis like this. I think moving forward, the city is now more prepared to handle a health crisis than we've ever have been before. We recognize the needs that we saw come out of the pandemic. And here's the thing, the disparities that were illuminated during the pandemic, we knew those disparities existed. But when someone has to get life-saving care, life-saving medicine, therapies, you name it, we have to find we are now better than we were in getting to the people, right? And also thinking about what they may need. Because a person who is of higher income status, their needs versus someone who is living with the hardships of poverty, two totally different. And so now I think we've worked that into the resilience operation of the city government. And I think that's something that, moving forward, hopefully we won't experience anything like that anytime soon, but we'll be more prepared. I think we look back at the pandemic, when we started these calls, Dr. Gray, we were all caught flat-footed. We had no solutions for what's going to happen to small businesses, what's going to happen to folks who are going to get behind on the rent, what's going to happen to, city workers, essential workers. Are they going to be able to get to work? Are we going to have to shut down trash pickup, things of that nature? Some of it we did not shut down, obviously. Folks started working from home, and we actually gained some innovations through some of this as well, right? Now we can work remotely. Now we can be productive working outside of City Hall. These are things we did not know before going in, but now are part of our day-to-day operations as a city government.
Thank you for that. A follow-up question, just one from a general public from the chat. It says, what is your view about permitted multi-unit housing to be built with less parking than we used to require, thereby encouraging more use of public transportation and bikes? So I guess, what is the future for Richmond in the context of public transportation and encouraging people to use more public transportation and making it easier for people to get around on their bikes and stuff like that?
So let's answer the first question. I'm all for it. Here's the thing. If Raleigh and Durham can have 30-story tall buildings, then the city of Richmond, the capital of the Commonwealth, can as well. All right, so I'm for density, and I'm for removing these parking restrictions and requirements. Here's my philosophy on growth. We need more homes, we need more units, so we need more density, and we need density everywhere. We need multifamily buildings everywhere. Arlington County is already having this discussion of the missing middle, right? Can 6-unit multifamily buildings be built alongside single-family homes? We have to think that way. More duplexes, more triplexes, more condos, all mixed in. Now, done with smart growth in mind, which means access to transit as well. I think about what we've done with the Pulse. If you look at the Pulse, the bus rapid transit down Route 250 Broad Street from east to west, you will see the enormous amount of growth, particularly when you go west past Belvedere. You've seen a tremendous amount of growth added to where VCU is located, along where the Fan and near areas like West Gray Street. But then look at Scott's Addition. Now, here's what we missed. I'm going to say it. We should have planned for the growth happening near Scott's Addition and adding a little bit more affordable housing to the mix. But here's the issue. In Virginia, we don't have inclusionary zoning. So when folks develop their properties, there is no requirement to include affordable housing at different income levels. So we missed the boat there, but there was a possibility of building a bus rapid transit route from north to south, from Henrico down south to Chesterfield. There's also, we're going to add the Fall Line Trail that's going to start in Ashland, in Hanover, all the way down to Petersburg. And Dr. Singleton, you know about, I think it's called the Beltline Trail in Atlanta. This will have a huge economic impact on the growth of a city. Now, here's the thing. We can't make the mistake that Atlanta has made as well, is where this bike trail or pedestrian trail now goes through some Black neighborhoods that aren't Black anymore. They've experienced gentrification and displacement as well. And to Dr. Gray's point, the G word does make folks feel a little icky, right? It makes you feel uncomfortable. I'm okay with the G word, but what I'm not okay with is displacement. Displacement, right? I want our neighborhoods to be renewed. I don't want to see, when I first started knocking on doors, become the mayor of this city, I would knock on doors in places like Churchill, in parts of Northside, and you would see rows and rows of houses that were abandoned. And now those houses are now occupied. What I don't like, though, is those folks who were living in homes being displaced and moved out to the counties. That's what I don't like. So in order to combat that, you need more units, period. You need more supply. So we have to invest in affordable housing, which we are doing. And we also need to move out the constraints, zoning, permitting, which we've worked on as well. Remove the constraints, make the investments, go vertical.
And I know our time is getting limited, but tell me about this innovation district that you're establishing.
Yes. So Dr. Nelson, Reverend Nelson says we'll take them in the county. Okay.
They already have.
Yeah. So here's the thing. We are one of our major projects. You know, we have the Diamond District that's in the greater Scotts Addition area, but we have what we call the City Center Redevelopment Plan. And the City Center Redevelopment Plan is north of Broad Street. It's the footprint of the old Navy Hill. Some of y'all know about Navy Hill, which found its way to Henrico County, but that's a conversation for another day.
Absolutely.
What we're going to do is we're going to demolish the old Richmond Coliseum, which has not been operational for 4 or 5 years now. We're going to build a 500-room hotel on that site, because right now our convention center, which was built at the beginning of the century, only uses 37% of the calendar nights. 37% since the beginning, since 2000. Think about that. So how much money we're losing out in tourism dollars, which we could invest in other things here in Richmond. 500-room hotel, but also you're going to see the expansion of the biotech park as well. Richmond, alongside Petersburg, were the recipients of the Build Back Better grant, $52.9 million to actually expand the biotech park. So Chandra Brigman can tell you a little bit about that as well. What I want to create is a center, a district where knowledge workers, folks who are working in the life sciences, folks who are working at Massey Cancer Center, folks who are working at VCU Health are colliding with other talented workers each and every day. You see it in Boston, you see it in other places. Well, we have the assets. We have VCU Health. We have J. Sargent Reynolds. We have the convention center. We have the biotech park, but we have all these parking lots that are not being used, just only for cars, right in the middle, which could be developed into vertical towers that house the most talented workers in the Commonwealth of Virginia, right here in the capital of this state.
Very good. Last thing I'm going to ask, one of the things that I've appreciated in terms of what the pandemic has facilitated is the collaborative efforts that we have had that I haven't seen among the faith community and other entities in the 27 years I've been pastoring in Richmond. And it's been a very, very positive relationship across federal, state, and local agencies, nonprofits, et cetera, et cetera. In what ways do you see that we could even increase partnership with you in the faith community?
Well, you know what, Dr. Gray, I look to you and say thank you, because it was your church at Fifth Street Baptist in Highland Park that stepped up and helped us with our homeless challenges as well. So I thank you for doing that. And here's the thing, we have a number of faith partners alongside nonprofits who are working with us on issues like gun violence in the city, youth development as well. These are things that I'm passionate about, because at the end of the day, local government can do but so much, right? And what I saw that happened in the pandemic was when local government was restricted on what we could do, it was nonprofits and the faith community that sort of helped help close the gaps and added patches to that safety net that we have. And here's the thing, there is a safety net, and the safety net is real. If you look back at what occurred during the pandemic, learning loss, libraries closed, museums closed, things of that nature, that sort of shutdown has devastated some of our low-income communities here in Richmond. And it will be, I think, worldwide, young people lost $1 trillion in generational wealth, $1 trillion. And so you get that down to the micro level, and how much generational wealth has been lost by Black and brown kids who are going to RPS who could not go to basketball, of course, could not because of the pandemic. It was nonprofits and those in the faith community that kind of helped us close the gap. And so I'm grateful for your partnership there, but we're going to need your partnership moving forward as well. And so your work, for instance, and having the courage to work with us on the homeless issue, we're going to need faith leaders like you to do more over the course of the next decade plus. I do believe this is Richmond's moment, but we just have to rise to the occasion. It just can't be a one-man or a one-woman show. We're going to get everybody to have hands on deck.
Hey, one last thing before I turn it over to Dr. Wynn. What color tux are you going to wear at your wedding next week?
We do want to know.
You do want to know, huh?
Yeah.
Well, you don't think I look good in this wine right here? No, you don't think so?
It depends on what your fiance has to say.
Well, I've been told I look good in blue, so that's what I might be going with.
Well, first of all, Mayor Stoney, I want to just say, first of all, I am proud to call you the mayor of Richmond, and really excited and proud of the work that you have done and continue to do. And just want to say to you, thank you for you. I mean, this city wouldn't have done what it has done. And with the faith leaders, and even with the Facts, Faith, and Friday, had you not been supportive from day one. And so I want to just personally thank you, sir, for your leadership and for your being the type of mayor that around the country, that whether it's Chicago or any other city, I put the mayor of Richmond up against anybody else and feel okay that we got the better end of that deal. So thank you, sir.
Thank you, Dr. Wynn. Thank you so much, Dr. Gray, and Dr. Sutton, Dr. Singleton. Thank you so much.
Thank you for always being there, Doc.
So before we close out, I would like to ask Reverend Gilliam to close us out in prayer.
All right, thank you. Let's bow for a word of prayer. God, we're grateful today for your continued love and mercy and care that you exhibit towards us each and every day. We thank you for this gathering of time of information sharing and learning and growing and hearing what is happening both nationally and locally around important issues to those who are a part of our faith communities. We're grateful for each presenter that is shared today and for their wisdom, for their knowledge, for their investment in this time that we've shared together today. We pray that you would continue to bless them, all of our elected officials and those who are serving in positions of decision-making power, that you would continue to keep them and cover them. Bless everyone who is on this call, every faith community, every organization who is on this call. May we continue to move forward in a spirit of collaboration as we move forward to ensure the health and the wellness of those to whom we are connected. Thank you for this time. Thank you for the Facts of Faith Friday team, and continue to bless us over this weekend. It's in your name we pray. Amen.